Hi, my name is Chyffon. We'll be evaluating the true access of the Russian healthcare system using the eight-factor model. Here's a little history about Russia. Russia's healthcare system was founded on the Chyffon model from 1918 to 1930. Although Russia is one of the largest countries, it is ranked number 130 out of 190 in the world, which is pretty low when observing other countries that we discussed this semester. The Chyffon model was designed to restructure the healthcare system that was devastated by World War I, famine, and disease, as well as to control the epidemics and infectious diseases. In the beginning, the Chyffon system was noted for its strong emphasis on the control of these epidemics and the diseases This led to the development of an advanced curative system infrastructure while establishing primary health care in rural and urban settings through health posts or polyclinics. Although the Chyffon model had its accomplishments, New Russia is still struggling to overcome these challenges that was left behind. For instance, primary care was marginalized, which is basically like the lack of attention on primary care. And there was hardly any attention on non-communicable diseases, which also suffer under this model. And access to labor-saving technology was very poor at the time as well. Okay, now we're moving on to the structure. New Russia began to go into transition around this time. Due to the collapse of the Soviet Union, the Russian Federation decentralized organizations of healthcare, which led to the three divided hierarchy levels, which were federal that dealt with state, regional, and municipal. Under the current structure, administrative responsibilities, the Ministry of Health operated at the highest level to formulate policy and provide oversight of the healthcare system. And as for regional and municipalities, they're also major providers of healthcare to the population, just in different ways. Basic services were offered to basic services are available in rural areas. So that is as if that the services offered in rural areas is sort of like geographically. They get their healthcare geographically. So basically it's like they're covering a specific population. So that's basically like small little clinics that might be staffed by maybe one physician, a midwife, and a dentist. So it's like really, really small, whereas to urban areas, they have more access to like a wide variety. They have more specialists. So like emergency care, cardiology, separate facilities for specific diseases such as tuberculosis, sexually transmitted diseases, or these places can also be known as dispensaries. However, they have a shortage in medical personnel. So for every 100,000 people that they only have like 431 physicians. And the problem with that is that most of the physicians are like specialized. They're not really specialized in like general health. It's more like on a specific level or something, like if you have a specific illness, specific issue, something like that. And also that most of their physicians in that area are old. So that like becomes hard I guess like progressing due to the fact that, they aging so quickly. And then the death rate is kind of higher there too. So it should be like a balance between young and old. And it's kind of harder to teach other people if you're not really having the time to do that. And then due to your age, you're not going to be, maybe as keen and observant as someone that's younger, that's like a fresh new set of eyes. And so for every 100,000 people, they only have 966 hospitals, which is crazy to me for the simple fact that they got all their land and there's so many of them over there. So it's like an imbalance access to care, dealing with actual hospitals and places to go, as well as having enough efficient and certified personnel medically. And here's another statistic: only 12% of our Russian physicians work in primary care, which is really, really low compared to other professions in the medical field. And there's only 23.67 inpatient care admissions per 100. So basically, that's like most people are like trying to self-treat their self, like treatments at home, or coming up with ways to like diagnose themselves instead of going to the doctor or going to the hospital or going to the emergency room, or like accessing any type of medical care where there is emergency care or home health. Okay, now we're moving on to the finances. Finances in Russia are brought through two different ways. They have private funding and public funding. However, due to the lack of regulations of the private care, voluntary insurance programs reduce the availability and quality of service under universal coverage significantly. So basically, that's like saying that like the poor really have to fight for healthcare, or they have to sacrifice a lot for healthcare, whereas the middle class, or what we consider as upper class, have more access to getting like specialists or getting better medical care because they can afford it. And that's what forced a lot of poor people to pay for like private insurance to get better care if they have like specific illnesses or something that's like out of the range of what we consider normal, which you're gonna provide that, which means that you're gonna need more care, more testing, more treatments. They're forced to sacrifice and take out a private insurance in order to ensure great medical care. Okay, and as this went along, that I guess they finally realized that this was a big issue, that they need to find a way to fix it to where that everyone had the right to free health care. So they came up with the budgeted insurance model to finance public health care, which was demonstrated through the Russian Constitution in Article 41. And through Article 41 was a mandatory medical insurance was achieved through the initiation of Article 41, which was legislated in 1993, hoping to lead to the increase of quality and delivery of medical services, as well as increase overall effectiveness of the healthcare system and reduce hospitalization to stimulate the development of primary healthcare. And another thing that wound up taking a big fall was their pay on medical personnel. By them trying to start this off and offer free this and free that, they were actually taking away from, I guess you could say, the wages of the medical personnel. So the employment numbers wound up skyrocketing. 621,000 doctors and 1.3 million nurses were unemployed in Russian healthcare. Since 2001, per capita health spending has fluctuated between 2.7 and 3.6%, resulting in an increase to 5.9% in 2009, which was about 2.3%, which seems kind of minute and small, but when you're analyzing everything, there's a very big jump in a short amount of time. If you're going to steady increase, it should be a slow increase, a 0.2, 0.3, something like that, so that you know that you're getting better at analyzing the issue and coming up with ways to solve the problem. But with a gap like that, that's letting you know that's a red flag that lets you know that something is going wrong or something is not working. Okay, now we're moving on to interventions. Russia attempted to basically develop a well-coordinated system and turn the healthcare system around to where it works for the people, as well as it works for the people that always works in healthcare, which is the medical personnel, whether it's physicians, midwives, nurses, CNAs, or things like that. So Russia's attempt to turn the obstacles around were through two key interventions. So the first intervention was the National Priority Project, which was aimed at addressing issues related to health, education, housing, and agriculture. There was also another project which was called the Mother's Fund, which was a child rearing program to assist parents of 2 or more children, which is kind of like what we have today, that when we have programs for single mothers with 1 or 2 children, or how we have food programs for them, housing, daycare, stuff like that. Okay, healthcare development. This also allowed us to further come up with different solutions to see what worked, which was the healthcare development concept, to 2020, which was the most recent reform that emphasized the transition to insurance-based healthcare, modernizing the government's mandatory insurance. Their goals was to reconstruct and update medical facilities, raise salaries of medical personnel, and reduce mortality from cardiovascular diseases. Okay, now we're looking at preventive measures. So, since the turn of the 21st century, Russia became very aware of the costly burden, both economically and socially, that they were having over preventive care. So basically, the government went back to the drawing board and started the things that they started the issues that were still progressing needed a way to basically slow down. Maybe not get all of it done at once, but at least make a big decrease. So they basically found a way to come up with prevention programs and treatment centers. So they joined the WHO Framework Convention on Tobacco in 2008 because one of the top causes of death deals with the cardiovascular system and like lung disease, and they like have a high rate of alcohol abuse and smoking, which is like one of their two of their biggest issues health wise. They also have a high rate for HIV and AIDS. So there was another prevention that they provided more education and treatment centers for those. Oh, and I apologize. WHO stands for World Health Organization. So there was a World Health Organization's framework convention on tobacco. And they basically picked up from Gorbachev's alcohol campaign that was like in the 1980s, but his didn't seem that successful, so they had to come up with a way to basically reorganize his goals and his focus on what he was trying to do. So they basically started to reduce alcohol abuse to get people help for that, and they planned on the construction of over 500 health centers. So basically, this like, like what places that they meet for like AA meetings or another type of drug abuse or things like that. This was like basically a place for that, or like the halfway houses. It was sort of like that, to where people could come get help without feeling embarrassed or ashamed of whatever issue and things that they were battling. Okay, we're moving on. Russia's highest cause conditions are related to non-communicable communicable diseases and injuries, which are inflicted or accidental. They also, the other preventative measures were um, making a change and moving toward the right direction. They were also facing challenges to like keep control on diseases. And the reason that they were having issues on these diseases was due to the fact that um, it was a lack of sufficient medical personnel because they were like inadequately trained. and a lack of support for the health promotion, which was coming from the medical personnel. Like they wasn't like supporting the best of practices to the patient or like they should, and a lack of patient empowerment, meaning patients needed to obey the doctor. But due to personal beliefs of specialization over primary care, that was a challenge to get them to just understand that basically any care is better than no care. Like you have to start somewhere in order to get better or find out what's the issue. Okay, now we're discussing the resources of the Russian healthcare system. Healthcare in Russia dealing with resources takes the form of herbal medicine, mystic, mysticism, acupuncture, and faith healing. Due to the high cost of medication, you find many Russians using long practice folk remedies and herbal treatments such as cupping, wrapping in vinegar soaked blankets, which I didn't know, and I thought that was kind of weird. I never heard about that one. Never really heard of cupping either. I saw this mentioned in an article I read during this research, but I never really paid attention to it. But I really thought that was weird to wrap in vinegar because I didn't really understand like what was the benefit of doing it. And drinking green tea with mint to cure headaches. That one, well, for me, that one works because my grandmother usually gives it to us when we have a headache rather than taking meds. She likes home remedies as well. Russian herbal treatments are respected and taught effectively in medicine universities. So I think that was like kind of great or different that they actually were teaching students herbal treatments to basically give the patient different options if they're not a fan of chemical medication and rather go through a natural way and letting your body like bond with nature and healing on its own. They also have alternative medicine, which is respected and widely used across socioeconomic status and position throughout Russia. There was a Russian studies a Russian study showed that only about 44% of Russians actually go to the doctor, which I don't think that is weird as much because I feel like the United States that we do the same thing depending on exactly like what is it. Cause I would like if I don't have to go to the doctor, like if it's not nothing major, I really don't like going for the simple fact the cost and the fees that they charge us for like simple stuff like if a cold or something like that, as well as for some reason I have been like very paranoid of going to the doctor. I guess because this is my second leg surgery and I just don't too much care for it. Okay, so Russia has a lot of major health issues. But the leading cause of death for them is cardiovascular disease, which kills about 75% in both men and women. But it's more profound in men. And like I told you guys earlier, alcoholism and smoking are their biggest problems in like population. Because it's so many of them that die from something so simple that you can like break yourself from doing or try to get help on fixing. So I found this chart online and I wanted to do like a comparison between Russia and the United States. Okay, so what we have in common with Russia as a cause of death for us is this: coronary heart disease, stroke, inflammatory or anything dealing with the heart, lung cancers, influenza, and pneumonia, which I thought was kind of weird. That was is it number 5 for them, and then it's number 6 for it's like we were neck and neck, and then also they were neck and neck with them on lung cancer, and coronary disease is the top one for us as well, which I thought was a little bit weird. But anyway, colon, rectum cancers, HIV and AIDS, stomach cancer, lung disease, and suicide. So, coronary heart disease is top rank for both of us, but in Russia they have 1,602,000 deaths, whereas we have only like 479,223, which to me is like a big gap, and I'm kind of proud of us. But I feel like Russia needs to like solely address that issue and come up with the way to really get that number down, because like that is ridiculous. Even though they're like way bigger than us, there's still a high number, and there's still a lot of people. Also for the stroke, it was 926,626, which ranked that one in top 2 for Russia. The third one was the inflammatory, anything dealing with the heart was 162,037. Lung cancer was 140,648. Influenza and pneumonia ranked number 5, which is 119,730, which I thought was pretty high. Like, I know, it's sometimes that people usually die from like pneumonia, but the flu, I guess like over here, that's like kind of out of the norm for me. I guess theirs is so high due to the fact that it's like extremely cold over here compared to us, but it's still a high number from my perspective, in my opinion. Colon rectum cancers is ranked number 6 with 109,377, which is basically right behind pneumonia and the flu. Like, it's really not that big of a gap. Maybe 10,000, which is really not that much when looking at the rest of the board. HIV and AIDS, which was number 7, that's pretty high in my opinion. When looking over to the next column and evaluating the United States, they're at 40 with only 6,660, and then you are crossing over to the 2-digit in thousands, which is like 4. I said it's like 10 times what we're having over here, 10 to 12, which is ridiculous. For the stomach cancer, it was ranking number 8 with 86,162. Lung disease, which this is crazy that lung disease and lung cancer is on here. And lung disease is half of lung cancer, but 78,140, and suicides, which was number 10, 66,156. And I thought that was kind of weird that the United States ranked number 12, 45,986. The disparities. When viewing the gender disparities, the mortality rate is higher in Russian men than women. The 3 leading cause of death: cardiovascular disease, cancer, and road accidents. And I know that it's kind of high in the United States as well, but for Russia, they just, I don't know. I don't know if it seems like they can't drive, or the fact that they're just not as aware on the road as they should be. But on to the next. Out-of-pocket payments. The poor spends 1.5 times more or their income for drugs and medical service than the rich, which I really think is unfair because if they're already poor, they're already struggling, and to spend that much just to get treated for something that's not your fault or something that came upon you, like, I don't think that's fair. I think they should like do like a charity or like have a separate fund available for them. But inequalities, there are a lot of inequalities in rural and urban settings. And the rural areas are like the inhabitants, which are referred to less, they're less often to have like outpatient care, which is like for the poor, like we discussed earlier. And they usually stay in the hospital longer, experience lower quality diagnostics due to the fact that they don't have the money to get the good medical care as they should. Um, and they also have a problem with spending. Like they have disproportionate public spending. Per capita, public spending is 4 to 5 times higher in rich regions compared to poor, which it should be the other way around because the rich can actually afford to get the treatment and medication that they need, or they should either split that in half to where the poor is actually, it'll kind of balance out. Not just take completely away from the rich, but the poor needs more help. Complex, decentralized health system, which was a barrier to equitable distribution of public funds. And this was my analysis on the Russian Federation healthcare system.